Right. Yes. So we are going to start the session. So I have sent you the PDF. We are going to do the test. Today we have, okay, spotlights. Our logo is a spotlight, and all the regular students, Carolyn, Janet, Mandeep. What you have to do is follow this. Every day I want your timetable. Okay. One student also, it's okay. I'm going to follow it up seriously. So we have timetable. So everyone will submit the timetable. Submit your timetable. Okay. Now you can see here. Submit your timetable. So we are going to submit timetables. Shiksha Tamam. Okay. I'm showing you how to make your timetable. So what you have to do is you have to copy like this. Take the timetable and yeah, timetable. I'm going to post your timetable. So today's time word is spotlight. Today's word is spotlight. You can see there. SPOTLIGHT, spotlight. Like how I am doing, you have to do. And today's day is Thursday. Today is Thursday. Thursday. And the date is 7 April 2022. Spotlight Thursday 7 April 2022. Spotlight Thursday 7 April 2022. And this is classical corrections at Grandmaster class. Complete mock practice test CPMT 72. Okay. Now this is when was that? This was April 2. So April 2, that is 72. So this is which day is Saturday. Okay. So this is CPMT 73. And this is Thursday. So what you have to do is say like this. So now you have to submit your timetable here like this. So this is, my name is Abraham Lincoln. So when you submit your timetable, okay, to me in WhatsApp, so you are submitting your timetable here like this. So spotlight is today's title, Thursday, 7 April, okay, 2022, classical corrections, complete mock test, CPMT 073, complete mock test 73, Thursday, 1 week. This number will be for 1 week from Sunday to Saturday. For registered regular students, you will submit your timetable like this. And name is Abraham Lincoln. So what you have to do is you have to change. Okay. Then the procedure, how you can do the timetable. Okay. The procedure, sorry. The procedure for doing submitting the timetable is this. So you have to copy first, copy the thing. What you have to do is you have to copy this one. Okay, same thing. Complete message you have to copy. So I'll show you in WhatsApp. So just copy whatever I put you for you in WhatsApp. You copy that, and then paste. Copy that and paste. So madam, Sampath, అక్కడ పాలు ఉన్నాయి అవి ఏం వాడద్దు సగం తీసేసి అట్లనే తోడేది Okay, so how you will do is like this. So uh, right, this is wizard. Wizards. Okay. So now what you are going to do is you will copy like this. Anywhere from anywhere, wherever it is written Abraham Lincoln, just copy. Now what I am doing is I am posting it here. Okay, like this. So finish. This is mine. Okay, then this is the way how you have to post. This is the method. Okay, this is the method. So copy, first you have to copy, then paste, then edit, then post. So copy, paste, edit, post. See, I'm copying now. First select. So selected, copied. Control C, copied. Then what I'll do is I am posting here now. I posted. I pasted. This is pasted. Copied from here, pasted here. Then what I'll do is I'll edit now. No need to edit from the beginning. Okay. Sorry. Okay, this is not copied. See, Sinu Joe's already posted. See. So Sinu Joe's already posted. Where is this? Yeah, see, Sinu Joe's already posted. Like that. You have to post your timetable like this. Okay. You have to edit your time also. Okay. And you see here this dot. When you have this dot, what you have to see that dot you have to maintain. See, Sinu Joe's. If you make this dot without space, then even Sinu Joe's will be bold. See, Sinu Joe's is also bold enough, like that. Okay. So this is number one. Sinu Joe's is number one. So that's it. Okay. Now let me show you. So what you will do is you have to copy. Okay. Copy that. Yeah. Copy that. And now posting. Pasted. Now I'm changing the name. Mandeep Kaur has posted. Very good. Next one is name. How I'll change my name? See here. Go here, Abraham Lincoln. Delete this name slowly. Don't delete the dot. Start. I'm changing my name. Margaret. Margaret Thatcher. Thatcher. Margaret Thatcher. No space before this star. Then you will change the timing. I'm Margaret Thatcher. Now I'm not Abraham Lincoln. So my time, I will be free only at 5 o'clock. So what I'll do 1700 hours. Okay, my local time 1700 hours. Okay. IST, India. I am from India. So IST. You are from which country? You write that instead of IST, you write whatever it is. Or change it into IST and write. And this is 1800 hours. And this is 1900 hours. And this is 2000 hours. IST. So finished. So this is Margaret Thatcher. Like this, we'll post. So, okay. See how I posted now. Margaret Thatcher name change. 1700 hours, 1800 hours, 1900 hours, 2000 hours. Finished. So like that you have to change. So now Sinu Jose has posted. Then Mandeep also has posted. See, this is Mandeep Kaur. Mandeep Kaur has posted. Okay, very good. Forward to wizard. So Mandeep Kaur is not there in the wizard or what? You can post it directly here. Number 2. Mandeep Kaur is number 2. Okay, let me see Mandeep Kaur is here or not. Add participant. Mandeep Kaur. Mandeep Kaur is there already. So you could have posted there directly. Okay, no problem. So all of you have to post like this your timetable. Okay, Janet, Diana, Carolyn, Maria, everyone you have to post their everyday timetable like this. Right. Fine. Right. Okay. Sorry. So we are going to take continuous sessions. Right. For the new students, if anybody is interested, we are going to start a new batch next week. So 7 students, nurses. Okay. New batch. So now, so this is our title for today, Spotlight. So you are on Spotlight. You are on Spotlight. Our program is on Spotlight. Grandmaster is on Spotlight. Today is special day, Spotlight. That means we are on the stage and we are dancing or singing or whatever it is. Spotlight is on the head. See here, on the head, spotlight from the center. Okay, spotlight from the center there. So we are in the spotlight on the stage, on the platform. So we are going to do listening test. Listening test. 7th April 2022. 7th April 2022. Right. Bear with me. Okay. We are going to see everything now. Right. Ray science. Ray science. So that's it. We are doing this listening session, Ray science. Okay. And we also have the other sessions. Okay. Ray science. Yeah. Ray science. Listening. 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 Thanks.
సార్ కొంచెం వేడి ఉన్నాయి గరం చేసిన
సరే సరే. So listening. Yes. I want to ask you now. There are Caroline Maria, Janet Kawaljeet. It is muted. Nobody can. Okay. So I'm asking you, do you want to the question, the big question for today? So today's session is spotlight. Spotlight. Okay. Question number 1. Question number 1. This is question for you. Do you have the burning desire to be the best? Do you have the burning desire to be the best? I want your answer. I want your answer. Okay. Yes. And you can message in the okay, to your friends. Okay. Listening subtest. So, listening subtest. The screen. Yeah. Right. So we are doing this listening test. Okay. Right. And that is raisins. Raisins. So the first question for the day for you is, okay, right. So the next question I am going to ask you, follow the system. You learn a lot today. Okay. So the question, okay, in between I'll be asking you questions like this. The question, okay, right. So because you should have to have these things. Okay. Do you want, do you have the burning desire? Do you have the burning desire to be the best? That was my question. Fine. So, do you have the burning desire to be the best? So today you have given time to me. Okay. Do you have the burning desire to be the best? Then you will be the best. You are second to none. You are extraordinary. You are special. You are outstanding. So if your answer is a yes, then you are standing out of the crowd. You are special. You are going to achieve your targets. Okay. Next question. Okay. Right. Next question is, do you have patience? Okay. Because patience is a virtue. Not every Tom, Dick, and Harry can have patience. Do you have something called patience? If you have patience, you will not panic. The people who are hasty, Okay. The second question is, do you have patience? If and only if you have patience, you can survive. You should not panic. You should not be upset. You should not be worried. You have to have patience. Patience is a virtue. Not every Tom, Dick, and Harry can have patience. People are impatient. Overcome that impatience and have that patience. There was an old sage, a hermit in the Himalayas. Somebody asked him, every day you are sitting, you are not doing any work, you are idling your time, you are not doing any work, only sitting there and just whiling away your time, and what you are doing. See how the world is busy and you are doing nothing. Don't you feel ashamed? There is no special thing in you. So go and do something. Then he asked him, okay, I'll do whatever you say. But will you do whatever I say just for 1 hour? Okay, tell me. If this brings a change in your life, definitely I will do. Come on, tell me what you want me to do. Okay, do one thing. Sit next to me, like how I am sitting. Don't talk for 1 hour. Don't move your hands. Don't move your legs. Don't open your eyes. Just meditate. Oh, what is this? Nothing. Just 1 hour sitting. What is that? That is what you are doing. Okay, you do and don't say anything. Your time starts now. He sat there 1 minute, 2 minutes, 3 minutes. His legs started irritating. 5 minutes, 10 minutes, he got boggled up. 15 minutes, he could not resist. And the 16th minute, he got up. He said, I cannot sit. Don't you notice what you cannot do, I am not doing? You cannot do you cannot sit for 1 hour. And you are talking about me. How much patient I am. You don't have that patience. You are restless. You cannot stick on sitting under this tree for 1 hour. But I am able to sit here for so long. It needs patience. You lack patience, and I have that patience. Learn to be patient. Patience is a virtue. Not everyone gets patience. So, I am better than you in patience. Then he hung his head down and he went off. Yes, sir, you are very patient. I'm really, of course, impatient, and everyone tells me that I'm impatient. So, do you have the patience? If you have the patience, the OET certificate is in your file. OET marks are in your pocket. The destiny is in front of you. Rule your world. Patience is a virtue. Do you have patience? So now we are moving forward. This is raise hands. while listening. Open, share with me. Sorry. Like, listen. This is the file. Sorry. Okay. Right. So this is it. So the listening subtest is the first test in the OET exam. So you will have tension. Suddenly starting the exam, and you have to overcome that fear, tension, panic. You have to overcome that fear, tension, panic. So how are you going to overcome that one? Stay silent, stay relaxed, stay cool, and stay composed. Whatever happens, let it happen. You should not be upset or worried. No panic. Okay? You can meditate for 2 or 3 seconds before every test. Every day you do one test like this, make some time and do one test. The listening subtest is the first test in the OET exam. Once you start the test, the fear will go. But before, until you get the paper and you put your pen, you will be little panic, shivering. So no. So be careful. So try to overcome that fear. Don't miss the session today. Take it as an order, take it as a suggestion, take it as a command, or take it whatever you want. But do not miss the session today. Those who are obedient students, those who are serious, you have your lunch in the session, you have your tea in the session, do whatever you want, but don't leave the session. So, the questions. So there are 3 parts in the OET listening subtest. 3 parts. Part A, Part B, and Part C. So 3 parts. And you are going to complete all these 3 parts at a stretch. There is no break in between. It's continuation. It's not like reading. The first 15 minutes you have part A separated. And next you will have 45 minutes part B and C together. This is not like that. This is at a stretch it will go. There is no divisions. So first part A, then part B, then part C. Automatically they will be moving on. There is no changing the question paper. Part A will be taken and part B and C will be given like that. Nothing like that here. Only once you'll get the paper directly. And you'll go till the last 40-second questions. Okay. The questions. There are altogether 42 questions in the official OET. 42 questions, which give you 500 marks. 42 questions for 500 marks. So you can check that one now. Approximately each question is 10 marks. Each question is 10 marks. And so 80 marks. So 420 plus 80. So you can take 84. So approximately 12 marks for each question. Less than 12, 11.9 something. So let us take the scoring. Let us think like that only. Each question 10 marks. Forget about the odds and evens. So for every question, you think you are getting 10 marks. So if you want 350, you have to write 35 questions correctly. Think like that. The extra marks, let me be bonus. So you have to be secured. You have to write 35 questions correctly. You'll get 350. So this is how you have to calculate. And you have to go ahead. Every slide is very important. I'm going to tell you how to manage everything. Test duration, the period of the test. The listening test will be approximately for 40 minutes. Approximately around 40 minutes. That is what it is. The listening subtest lasts for around 40 minutes. So these 40 minutes, you have to be very careful. You should not see here and there any disturbance here and there, nothing. If you have a headphone, that's excellent. Sometimes they will give open sound system. They'll put you in an auditorium and they will leave everything there. And some sounds, external sounds influence also may be there. Sometimes chances are there. If somebody drops his pen or pencil, that is a distraction. Somebody drops his book or paper or whatever it is or taps his feet, that's a disturbance. So there may be chances, but you have to be very strict and you have to be listening, not hearing. This is a listening test, you remember, not hearing. Now, what is the difference between hearing and listening? For many people, it is one and the same. But for me, it is different. I hear everything possible. There is no limit for hearing. That means even if I don't have interest, I have to hear. Breeze, paper rustling, somebody tapping his feet, fan sound, AC sound, cars honking, somebody talking, somebody whistling. and the audio going on. So, any sound, because the ears are open and the eardrums are active, sensitive, you will hear everything possible. A mosquito buzzing, a housefly, whatever sound you will hear, you are prone to hear. There is no excuse. It happens automatically. You need not pay attention to it. It automatically, even if you close your eyes, you close anything. The ears are open, you will hear. Hearing happens automatically. That means everything from morning to evening while you are in sleep or awake, okay, eating, drinking, dancing, doing whatever you want, you hear things. You hear things. Unless and until you are deaf, you hear things. That's it. No question, no excuse. 24/7, you hear things. That's what happens. Then what is listening? What's the difference? Why it is not hearing test? Why is it listening test? Listening is something different. Listening happens with intent. Listening happens with interest. Listening happens with concentration. Listening happens with attention. Listening happens with focus. Anything missing and it is not listening. If you have no attention, if you have no concentration, if you have no interest, if you have no focus, you cannot listen. For example, you are in a bus and everyone is talking and the radio is playing, radios are playing, the mobiles are playing. Somebody is talking on the mobile loudly and the television is running. The voice is loud. But next to you, your friend or your brother or your father or your mother or your wife or your husband, somebody is sitting, your son or daughter, and you're talking to them. In spite of the heavy sounds, deafening sounds, like the trains in Mumbai and the trams in the metro cities or in the fish market or supermarkets or open markets, street markets, everyone is shouting, but you will be able to listen to your friend's voice because you have interest, you have focus, you have concentration, you have attention. The train sounds, the wheels, the wind, everything, in spite of everything, you will focus, pay attention and concentrate and listen to your friends or relatives' words. You will not miss a beat. That's listening. Hope you understand what is listening. So, focus, attention, concentration, techniques, and strategies is the sum totality is listening. So don't say I get listening less marks, sir. I got listening less marks. That is utter nonsense. If you focus, why you will lose marks? How come you will lose marks? Never. Possible. Okay? Not at all possible. So facts. Facts. This is an acronym. I created this. Facts. The facts, the fact of the matter is this is one word, but it is an acronym. It is not FS. That is different from this one. Sorry. The above one is an acronym. The lower one is a word. This is a word. But this is an acronym. What do you mean by acronym? What do you mean by acronym? Okay. I'll show you what do you mean by acronym here. So, facts. Right. Focus. Okay. That is focus. And the second one is attention. Okay. And the third one is every letter stands for a word. That is the meaning. Concentration. Techniques. And strategies. Okay. This is number 1. This is number 2. This is number 3, 4, and 5. So there you are. So focus, attention, concentration, techniques. Okay. So focus, attention, concentration. I'm teaching you a lot of things today. How to get the perfect score. You can get the perfect score, 500 out of 500. Definitely. There is no slip. You have to get. When you want something, you have to get it. New. Lecture. Themes, presentations. Lecture. Yeah. So if you want 500 out of 500, well design, celestial design, presentation title. Give me a minute. I want to give you something very important because we are designing something extraordinary. So be patient with me. We want those who want to get 500 out of those who want at least to dream 500, you will get 450. Those who have the desire, I told you already, you have patience. I have all the patience for you. Okay. presentation, education, yeah. Presentation. See what else. Yeah. So facts. First one is focus. Second one is attention. Third one is concentration. Fourth one is techniques. Fifth one is strategies. Bear with me, please. I am doing something for you. Strategies. Yeah. Right. These are the 5 different things we are going to do. Now, how to enhance our focus? How focus means not to miss anything. Not to miss anything. Attention means what? Come on, come on. So, we have these 5 different things. So, focus, attention, concentration, and techniques. Okay. Okay. Next. Right. So, slide. Yeah. Fine. So, facts. You have understood the 5 different things. You have understood the 5 different things. Focus, attention, concentration, techniques, and strategies. Right. So these 5 things play a pivotal role in listening. So all these things, if you apply, definitely you can get 500. Okay, fine. We don't need 500, but at least 450 you'll get if you target 500. Next. Now here, why you have to focus? Okay, why I'm going to tell you now. Now you have a number of audio recordings. For example, in the listening test, you will have part A, part B, and part C. In the part A, you have extract 1 and extract 2. Extract 1 and extract 2. That means you have 2 recordings. First recording is raised hands and second recording is Peter Simon. So like that, 2 different recordings are there. So for the first recording 12 questions, second recording 12 questions. How are you going to manage this? Your mind should be ready to change your approach. Okay. Now here in part B, 6 questions are there. There are 6 separate, no continuous. Not continuous, no continuation. See, I told a mistake. I made a mistake. I said no continuous. No continuation or not continuous. I messed up both and I said no continuous. So mistakes happen. It's human to make mistakes. But we have to correct it and accept that we are doing mistakes. Don't say, it's okay. That is carelessness, recklessness. Okay? Lack of responsibility for your own growth. That's very clear. It's stamped, rubber stamped. Okay? So shoulder your responsibility and learn. Now here, you hear each recording once only. So once only. There is no repetition. Once it's lost forever. And the recordings will not be repeated. That's why you have to focus. The answer will come just like that. We don't know how fast the answer is coming, from how much distance it is coming, and in how much time answer is coming. We don't know. Speed is equal to velocity into distance. Physics sample. Rule, principle, equation. Right. So distance is equal to velocity into time, or whatever equation you can take. I'm not pretty sure about the equation, but I'm just telling you. So the question, you see cricket ball. Cricket ball is coming from the other side and you are the fielder. You are trying to analyze ball is coming, how far it is coming from, what is the distance it is now, and how much time from that distance it will come to me. Okay. And what is the speed it is coming, how far and how much speed and how much time, how far, how fast, and how much time it is. If it is coming very fast, less time. If it is coming very slow, more time. Okay. So how much distance it is? The distance is more time. Distance is less time. So it depends on like that. So you have to analyze. The answer is coming. Many people, no, sir, I was thinking, I mean, the second question, fourth question answer also is gone, sir. What to do, sir? I got panic, sir. I don't know. By the time I overcame panic, even the first listening extract is finished, sir. I lost all the 12 questions, sir. Only 1 and 2 I wrote, sir. Others I left blank, sir. Nonsense. That is why I am telling you. There are many people who do like that. After that, they lose their interest in the test itself. Don't do that. Don't ever do that. So, that is called focus. Focus. 1 second before, if you close your hands, the ball will hit on the top of your, the bottom of the ball will hit the top of your hands, thumbs, and fall down. Because already you closed the hand. 1 second before, 1 second before. That bottom of the ball will hit the top of your thumbs, hands, top, and it will fall down. The ball is on the ground, no more. 1 second you are slow, late, the ball already slipped through your hands, and the top of the ball will hit the bottom of the hand and it will fall down. I'm not talking nonsense, I'm telling the fact. You ask any cricket fielder, he will tell you. 1 second is the time. Okay, that rules everything. Exact second you close your hands, the ball is safe in your hands. So that is what I'm telling you. That is the focus. Ask somebody to throw the ball, okay, and you catch the ball. Otherwise, it will hit your stomach also sometimes with force. Okay, so the recordings will never be repeated. So be careful. Don't think what I'm telling you are just coming like that. There are years of experience, lot of slides from years together. I am pulling them from my memory lane. Yes. Practical approach. I was telling you facts. Now I'm telling you approach. Practical approach. Practical. What is practical? Okay. So practical approach is different from theoretical approach. Theoretical approach means just in theory or practice. Practical approach means every day you do practice so that when you go for the real exam, it will be just like another practice match. It will be like another practice match. If you do every test at home, like exam, with the same intensity, not playing the fool around, not fooling yourself. Okay, one session I'll do now, one session in the afternoon, one session in the evening. Whenever I get time, I'll do. This is all nonsense. You're fooling yourself. So practical approach means, in reality, how the OET test is there, how it is conducted. When you sit for the test, you will not get up from the seat until OET is finished. So like that, you have to sit. That's why I'm giving you these timings and I'm trying to, familiarize you the system of OET. So if you every day do like the OET exam, everyone wants to do the test, but how they don't want how and why. They just want to do OET, that's all. Right. So practical approach means do like the OET test, occupational English test, OET. Don't do as how you want. Do as how OET wants. Do the test every day as how OET wants. In 40 minutes means 40 minutes, 39 minutes means 39, 42 minutes means how much ever the time is there, that much only you take. Don't take even a second more. Don't take even a second more. And behave as if you are in an examination hall. No disturbance from anybody. Because focus and concentration is not so easy. They'll not just come like that. Ask your beloved people, please don't disturb me. I'm going to do a test. Whatever happens, manage yourself, but please don't. This is my dream. And if you are not going to support me, then who will support in the world? Who in the world will support me? You have the right to demand your husband, your wife, or your children to support you. Who will not support? They will support because it is your dream. Convince them. This is called practical approach. Just going in front, everyone is there watching television, you will sit there on one corner and their sounds are coming here. Somebody is playing and that fellow crying, somebody is crying and cooking. Yesterday somebody told me, sir, every day, even in the kitchen, when I am cooking also, you know what I do? I listen to your videos. I told, Ba, please, mother, don't do like that. Huh? Cooking in the kitchen, oil, water. Huh? Something falls on the hands. Okay, burns. All this nonsense. Listening, do like listening, not with cooking. Don't mess it up with anything else. That is called practical approach. Sitting in the hall when the TV is playing and taking one listening, putting headphones and doing. Suddenly, your son or daughter will come and say, Mama, Mama, and you have to get distracted. Go lock yourself in one room. You have to have that courage. See, myself, I lock the room. Nobody will come unless and until I want them to come. Nobody will come unless and until. And somebody comes, brings tea, puts there and goes off. No song, nothing. Unless and until it is very important because my sessions go long. So you have to have a practical approach. How to face listening. You have to face listening like how OET gives you listening. Don't try at your own comfort zone. And don't say, I want to clear OET. And you can never clear OET. That's very clear. You are at your comfort zone and you say, I want to clear OET. You leave clearing OET. That's impossible. Okay? You have to struggle for that. And be prepared before the test day. All the three separate parts, A, part E, part C. You have to be familiar because every part has a different strategy, approach, techniques. Okay. There may be cause and effect relationship. You have to deal with it in a different way. Advantages and disadvantages. You have to deal it in with different way. Then increasing or plateau or decreasing trends. One is upward trend, one is flat, and the other one is downward trend. First one is increasing, second one is no increase, no decrease, third one is decrease. So these are the three styles. Sometimes initial, medial, final. This is another style. So how you have to be prepared. Even before the test day, you have to know how to do all these things. Just going to the exam and come blank. 5 times I wrote, sir. Yesterday somebody was saying, 5 times I wrote, sir. 6 times, 7 times I wrote, sir. Princess of Persia. Okay. Daughter of a wealthy businessman. 7 times you wrote. Whose money is that? Do you think it is your money? Definitely not. Definitely not your money. That money you might have earned, but it is not your money. If your children will not allow you to go and work, then where will that money come from? Your children sacrificed to stay away from you for 8 hours, so you are going to for duty. Your children are cooperating with you. They are not fighting, they are not disturbing, they are not troubling. That's why you are peacefully going and working for 8 hours. You have to be responsible to your children. If your husband or wife will not allow you to work, where will that money come from? How cooperating is your family? It's a family money. Something might be useful for that. You have spoiled that money 7 times. And you are saying, 7 times, oh, Gajini Muhammad. There is one person called Gajini Muhammad who invaded India 17 times. 10 more times you go and invade, no? Making a nonsense of your own money and your own family's love. Try to decide when to go for the exam, you don't know. When to book the test, you don't know. Your family is very friendly. They excuse you, they forgive you, they spare you. They will not blast you, they will not shout at you that you are wasting your money. That doesn't mean that you have to take it for granted. Be wise enough. Lot of wisdom you have, lot of knowledge you have, lot of understanding you have. I am not preaching something, I am telling the fact. The fact of the matter is you are taking advantage of your family love and spoiling the money. Think how useful you are, how wise you are. That's not my problem. That's your problem. You have to deal with it. Only I have to give. This is an eye-opener for you. I'm telling you, I don't know who is there off screen. There may be one student or two students or three. I even don't open my eyes. I close my eyes because I'm talking with the words are coming directly from my heart, not from the brain. These are words of love. These are words of concern. These are words of affection. Nobody is asking you. That's why you are doing whatever manmani you say. This, whatever you want to do, you are doing. Making a mess of everything. Okay. So, what he is telling you here, see again, familiarize with the format of each part. You don't know that this is based on synonyms. What words will come? What vocabulary will come? What relation is there? Is it cause and relation, cause and effect relation? What type of relations will be there in the test? In B, okay, in A, what vocabulary is important? Nouns are important, or verbs are important, or adjectives are important. A means one. One means a singular. A book will come. Yes will not come. So you should know. And means some means books. S should be added. Several, yes should be added. Many, S should be added. A, no S. A book. An egg, no S. So one, single. So such things you have to identify. The word before, the word after, in is there. In, a word in, I and in is there. What is the word which comes before? What is the word that comes after? The word which comes before is a noun. The word which comes after is also a noun. Pen in pocket. Book in shelf. And before shelf, the will come. Book A, blue book in the big shelf. So noun will be there before and noun will be there after. And before that noun, adjective will be there. A blue book. Blue is an adjective. A blue book in the big shelf. Big is an adjective. So how the words come? You have to justify. Without doing anything, just waiting for the audio. Why audio is not playing? They are seeing here and there. Yeah. So now try to understand what he's telling here. All of the listening content is appropriate for healthcare professionals in all the 12 different professions. What do you mean by this? This means that whether you are a nurse or a doctor or a podiatrist or a physiotherapist or whatever, or a dentist, so whatever your profession is, all these extracts are appropriate, means similar for everyone can understand. It is not like that they will give only medicine related material and others cannot understand. These are general material, not specific material. They are general material. General material, that means anybody can listen and understand. Anybody can read and understand. Common. So you should know that. So what you have to do is, once there was somebody who asked me, sir, give us a listening and reading for doctors. I said, you're a doctor? He did not understand. He said, yes, sir. Then he did not understand. Then I told him, it is common. So you have to apply. Before asking somebody, you have to understand yourself what it is. You make a research out of it, you will understand everything. So what I tell you is, you have to research. So what type of questions are asked? For example, if it is common, that means it is not specific. It is general information. Not specific means it doesn't imply only to a particular profession. It doesn't go deep in the subject. For example, it doesn't talk deep about surgery. Superficial discussion. What happened? When did you take surgery? Like that, just general things. He will not talk about year, complete year, what is there in the year. He will not explain everything. Okay? He is not going to demonstrate everything. He will go a superficial level. He will not go deep into the waters. So they are simple, ordinary, easy things. So if you don't get at least a 35 in easy things, what is the meaning there? Huh? These are all easy things, simple things, common things, usual things, general things, normal things. Simple, normal, usual, normal, general, usual. See, all these are synonyms. Commonality. That's what I told you now. What do you mean by commonality? Commonality means everything in common. That means no need to worry. That means it will be easy. Common things, general things, usual things. So commonality, common things. So there doesn't need any specialist knowledge. Okay? That doesn't need any specialist knowledge. So they are general, no need, no special, nothing special. Only a doctor can do. No. Even nurse can do. Even physiotherapist can do. Anybody can do. So that is called common. Common things will be simple. See, for example, bus stop is a common thing. Anybody can go. Rich man can go, average man can go, poor man can go, even a beggar can go, anybody can go. Common. But five-star hotel is special. Only people who can live in five-star hotel will go into five-star hotel. And slum area, only people who can live in slum area can go into slum area. The rich people cannot go there. They cannot survive there. Okay, so you understand now what is common, what is special. In slum area, you have to be special. Then only you can live in slum area. That means you have to be ready to survive in even disastrous situations. It's very difficult. It's not easy to live in a slum. Mosquitoes, trouble everywhere. So only special people who can live, who can bear the sting of mosquito or the bites of mosquitoes can live there. The rich people cannot live there. They cannot survive even for 15 minutes. They cannot even go inside. So that is what is called special. The poor people are very special, so special that only they can survive in the slum areas. So that is not particular. That is not ordinary. That is a particular group of people can live in particular place. The particular group is poor people can live in particular place, that is called slum. That is special. Special people, special place. Slum is a special place for poor people. Five-star hotels are special places for rich people. Special people cannot live in slums. Rich people cannot live in slums. Poor people cannot live in five-star hotel. That is what it is. Only they can handle those situations. That is not like that. This is commonality. That means anybody can do. Superficial layer, that's all. Right. So remember that. If it is common, then why people are not getting scores? Because they are careless. They don't know when to book the test and they are booking their test. So I don't know, you have to judge, they have to judge themselves. I am no man to judge them. Okay, they should judge how wise they are. They cannot decide. Okay, prepare and go for the test or apply for the test and prepare. I don't know. If you want to apply for the test and prepare, at least after 6 months you book. No? There are no dates, sir. So there are no dates. That's why you are booking. Because of that one, you are pressurized, and because of that one, you don't get leave. You don't get anything, and you make nonsense out of everything. Right. Now, next one, criteria. Now, what is this criteria? The listening content tests the candidate's level of English language proficiency in a healthcare specific environment. Healthcare, not medical or not anything. It's healthcare, general, all. Like in a hospital, like a family visit, home visit, or a clinic, or a training, anything related to healthcare professional in that environment. So the test content, the listening content tests the candidate's level of English language proficiency. Sir, I am not getting B, sir. I am not getting B, sir. That means that is your level. Why are you crying? I am not getting B. Instead of crying, okay, tie your shoelace and start running. Start acting. Start preparing and practice. I am doing self-preparation. How much can you do self-preparation? Okay. Who will teach you? You are doing 3 times exam and still you are not getting results and you are doing still self-preparation. You have to go to an expert. Go to a professional English teacher. Don't go to some other professions. Don't go to a lawyer or an engineer who knows English. Don't go to a doctor. Don't go to a nurse. Don't go to any other professional by that way. Go to a teacher who is qualified. Okay. So, because he is proficient, he will explain you what is what, everything. He will rip apart into pieces and show everything. This is this, this is this. He will tell you. Okay, don't take everything lightly. Our lives have lives are wasted taking things easily. At least take seriously now. So, English language proficiency in healthcare specific environment. What is required in a particular healthcare environment, that level of English only will be given. How to deal with patients, how to talk with another doctor, how to communicate with other professionals, how to communicate with colleagues, how to give detailed instructions, all these. So you have to be proficient, means you have to be expert. Analysis. Now, let us study the three parts of the listening subtest separately. We are going to study the three parts of the listening separately. So, first we'll take part A, then we'll take part B, then we'll take part C. So, don't take all together. Don't take everything together. Take part A and finish off everything. Then we'll go to part B. We'll finish off everything. Then we'll go to part C. Then we'll finish off everything. I told you this is going to be a workshop. Right. In part A, there are two different consultations. The first one is totally different from second one. They are not related in any way. That is a separate entity and this is a separate entity. So no need to worry. So that one starting something new and ending, knowing everything about that. And second one starting everything new and knowing everything about by the end. So once it is ended, that is a whole in itself. Part A, first consultation has no relation with anything else. That is an end in itself. That is the be all and end all. That's it. It has no connection with others. That's it. Watertight compartment. It will not be carried to the second one. So when you start the second one, consultation, again your mind should be fresh. You have to shake off all the things which went into your brain. Immediately be ready with the second one. That means every extract is a new test like that. You have to start everything fresh. When you finish the first consultation, you have to forget that one totally. It should not be carried to the second one. Again, second one, you think that it is a new test. Second consultation, 13 to 24, totally new. You have to take it as a fresh one. So keep your mind fresh. Forget the past. So now in each consultation, A healthcare professional is talking to a patient. So try to understand what he's telling you. In each consultant, take one consultation only first. Consultation A only we are talking. So a healthcare professional is talking to a patient. It's a both are consultations only. In both the areas, in both the consultations, there will be one healthcare professional and there will be one patient. So the healthcare professional is the authority over the subject, and the patient is the subject. He will comply with the healthcare professional. Whatever he asks, he will give. Whatever he tells, he will take. Whatever advices, whatever suggestions he gives, he will implement. The advice is put into practice. So all this, whatever he advises, he'll be putting into practice. See here, healthcare professional is talking to the patient, not a patient is talking to a healthcare professional. See, it is a reversal. A patient is not talking to the healthcare professional here. So who is important person will come first? Don't you read between the lines? In each consultation, a healthcare professional is talking to a patient. That means the ruler or the king is the healthcare professional in the consultation. According to his guidance only. If he asks, tell me about your diet, then he will not tell about football and basketball. So that means the entire plot is constructed around the healthcare professional. Whatever the healthcare professional wants, that will be done. Not what the patient wants will never be bothered about. So the person who is writing this consultation, who is managing this consultation, that means the healthcare professional is the responsible person. The patient is not responsible here. So he has to manage it well. Like your role play. It is the nurse's role play or the doctor's role play. So you have to manage. Patient has nothing to do. Whatever you ask, he will tell you. Whatever you tell, he will do. That's all. Take these medications regularly. Why should I take, madam? Please tell me, then only I will take. Okay, these are important. So whatever you tell, he will follow. So healthcare professional is important here. Yeah. In each consultation, there is one note completion activity. There are 12 fill in the blanks. Note completion. Note, there is a note and you have to complete it. What does that mean? That the notes is incomplete. The information which is provided on your paper is incomplete. And it is your responsibility to listen to the audio, find out appropriate information, accurate information, and write the relevant information in the blanks provided. There may be some gaps between two answers, or there may be immediate answers. So you have to pace up yourself, speed up yourself. So, note completion. What do you mean by note completion? You will say like this. Worked as a dash, a blank. Worked as a blank. So he will ask the doctor, what did you work as 10 years before? He'll say, I was a steward. I was a waiter. I was a manager. So you have to listen very carefully and write that word waiter or steward or manager there, because A is also there. If A is not there, you have to say a steward, a manager. So you have to fill in the blanks. You have to fill in the blanks. Next. Now duration. The part A lasts around 10 minutes. Part A lasts around 10 minutes. Each consultation is around 5 minutes. So 5 minutes is the first consultation and 5 minutes is the second consultation. So within 10 minutes, everything is done and dusted and you'll forget part A and you'll move on to part B. So this 10 minutes will just fly like that, because there are 24 questions and in 10 minutes. And afterwards, you will have only 18 questions and you have a lot of time, 30 minutes. So that is the difference. 24 questions in 10 minutes, 24 questions in 10 minutes, and 18 questions in 30 minutes. See the difference there. So 24 questions in 10 minutes means you can understand there. So more than 2 answers will be finished in 1 minute. So 2.4 answers, almost 2.5 answers, 2.5 answers in 1 minute. 60 seconds, 2.5 answers. That means 60 seconds, 2.5 answers means, so you can say 25 seconds. Within 25 seconds, one answer will go. 25 seconds, just like that. So you have to be very careful. You have to be extraordinary. You have to be extraordinary. Next. Assessment. Now, what do you mean by assessment? Part A tests the ability to understand and record specific information about the patients. The patients are telling something, and if you don't understand, so now see here. Part A tests the ability to understand and record specific information about the patients. So the healthcare professional is asking questions and the patient is giving answers. I had a surgery. So if you don't understand what he is telling, surgery, and you miss that one, then how can you work as a nurse? How can you work as a doctor? He's telling, I had pain in the shoulder. So, dash pain. Then what you will write there? You will write shoulder pain. So you have to listen in the flow of speech and you have to catch that answer and you have to write there, a pain. I had pain in the shoulder. And answer in the question paper it is there, dash pain. So shoulder pain. Pain in the shoulder became shoulder pain. They may twist anyway. They may twist anyway. Pain in the shoulder becomes a shoulder pain. So you have to be ready for that. People think we can do, and they go for the exam and they fall down flat and they get defeated and they come back and they cry. I wrote 3 times exams. OET is making money. Huh? Empty vessels make much noise. Empty vessels make much noise. These are the people who cannot do anything. So they tell OET is like this, OET is like this, that is this is this. I wrote 5 times, 4 times. Empty vessels. So they have to fill themselves in. So they have to transform themselves into filled vessels. They have to change their lifestyle. They have to change their learning style. They have to transform their study patterns, study modification, study pattern modifications. Okay, study style modifications, like lifestyle modifications, study style modification. You tell you have to modify. Lifestyle modification is very important. Yes, for you, study style modification is very important. Okay. So this is assessing specific information of general things. For example, if he tells, I have a disease, and he'll say, after 10 seconds, he'll say, coronary artery disease. Then what you have to write? First he told disease. First he told disease. Then he told coronary artery disease. Now disease is a generic information, general information. And coronary artery disease is a specific information. Okay. Then I have problem with my children. Suppose I have problem with my children. He tells, I have problem with my children. Then after some time he'll say, after 10 seconds he'll say, they make too much noise. So what is the problem? Children are the problem or noise is the problem? So he has not a problem with children. He has problem with noise. So if children do not make noise, that means he doesn't have problem. So noise problem. So now you understand what is general information. Problem with children. Children is problem, of course, but it is general information because they are not the main problem. They are making noise. That is the main problem. So that is specific information. If you write children, that is wrong. He is irritated with noise. Otherwise, he is happy with children. Yeah. So I want to ask you one question. Now, the question is, there are 11 students. Very good. I thought there will be only 3 or 4. I thought that there will be only 3 or 4, but still, because nobody has that patience. But I have seen here 12 people means too much patience. So, is the subject I am teaching important for you? This is the question. So, normally I am teaching every day. That is different thing. These are the basics. You should know. Many people don't know what to do, when to do, how to do, why to do. They just do the test. So hit the button. Yes or a no. Because if you say no, then why should I waste my time? If you say it is important only, I will explain. Yes. Now part A is done. We are done with part A. Now we are moving to part B. There are 6 different extracts from various situations at the workplace. 6 different extracts. What do you mean by this? That means they are totally separate, different entities, watertight compartments. A doesn't have any connection with B or B with, so any two extracts have no relation. Totally independent, and they exist separate from others. One may be about medication, another may be about training, another may be about care, next one may be about age, next one may be about health. So like the different, no way anyone is touching the other area. Watertight compartment. So one is finished. You drink tea, you wash the cup and keep it there, fresh again. So like that, you do one extract, you finish that one, leave that one and go ahead for the next one. Forget about it. So 6 different extracts and various situations at the workplace. One may be a home visit, one may be a clinic, one may be operation theater, one may be training program, like the different setting, platform, workplace. So these extracts, 6 extracts are there. In each extract, you hear healthcare professionals either talking to each other or to a patient. Now, what do you mean by this? So there are 2 healthcare professionals, suppose, a nurse and a doctor, or a doctor and a physiotherapist, or a nurse and a physiotherapist, or a surgeon and a doctor, or a senior nurse, charge nurse, and another nurse, registered nurse. So like that. So they are communicating with one another. They are sharing information. They are passing on information. One is that within the professionals themselves. Within the professionals themselves. Or these healthcare professionals are talking to a patient. That means a doctor is talking to a patient who visited him for a consultation. So otherwise, after the operation, a nurse is telling the patient how to take care of himself, post-operative care. Or the person who is giving anesthesia before a surgery is telling the patient that nothing is going to happen and it is quite common, and educating him and going to give anesthesia, local anesthesia. So the setting may be different. Or the patient who has toothache is sitting in the dentist chair and the dentist is about to work on his teeth, and before that one he is going to talk, or after his work he is going to talk with the patient. Anyway, So, or a pharmacist is talking to the patient how to take medications, anything in that matter. During a home visit, a nurse is telling how to self-inject insulin injections. Right. The activity, what are you supposed to do? There is one multiple choice question to answer regarding each extract. So, multiple choice question. You'll have listening comprehension. You'll listen to somebody speaking to somebody. A healthcare professional speaking to another healthcare professional. A senior to junior or junior to senior or two colleagues of the same cadre. Or a nurse or a doctor or a physiotherapist talking to a particular patient related to their area. He's telling him how to go ahead with his physiotherapy sessions. Or nurse telling about how to manage many different things like exercise, food, and medications. Or a doctor educating the patient that smoking and drinking should be stopped and take a healthy diet and plenty of fluids to the patient. So this is how it goes. And there will be 3 choices, multiple choices. The question answer is only one, which is right. The other 2 are called traps, misleading traps to trick you. The traps, those traps are meant to trick you. Next one. Next one. Yes. Now the duration. Part B lasts around 10 minutes. So in 10 minutes, you'll have 6 questions. That means it will be something around less than 2 minutes, more than 1 minute 40 seconds, and less than 2 minutes. So each question is more than 90 seconds and less than 120 seconds, approximately 140 to 145. Okay. Next, you should measure very carefully. Time is very important. Time is ticking. Time is ticking. So what you have to do is, you have to finish the answer when it gets, and before you will have some time. You have pre-listening time, maybe 20 to 30 seconds, until the beep counts. You will say, now you have some time to look at the question. And some people even don't look at the question, they will look at the next person, back and front and up. So he's telling you to look up your questions, means that do some skimming and scanning. Do some skimming and scanning. So has to do some skimming and scanning. Has to do some skimming and scanning. skimming and scanning. You have to prepare. Skimming and scanning. Now here, each question has reading time and listening time. Now what is this reading time? That means he is giving you pre-listening activity. That means before you listen, you have some time to look at the question. What do you mean by look at the question? Means study the question, not read the question, study the question and find out what are important points there in the question and underline, circle, make arrow marks, up arrow, down arrow. Increasing means up arrow, decreasing means down arrow, past means left arrow, right means future means right arrow, present means down arrow. So like that you can make. Okay. Before means back arrow, after means front arrow. So like that you have to make some notes. Important word underline, most important word circle. That is what you have to do. That is called studying. What is best, what is excellent, what is extraordinary. You have to study that. That is called pre-listening time. The next one, post-listening. While listening, when the audio is playing, you listen. When the audio is playing, you listen. And when you listen, the same time you will write the answer when you get the word immediately. Not after listening, you will not write. During listening only you will write. If something is wrong, you can erase and cut off and write again, no problem. Immediately you have to write. Now the assessment for this. Now what do you mean by assessment? Evaluation, examination, testing. Okay. So this part B tests the ability to understand. It tests the ability to understand. Now, what do you mean by this test to ability to understand? So, whether you are capable or not, do you have sound mind or not? Are you ready to catch the words or not? Somebody is speaking in a natural tone, natural speed. Are you able to figure it out what he is telling? Is the message conveyed to you? Are you able to grasp the specific information or not? The meaning, the essence, the important points, and come to a conclusion or not? So overall, everything perfect, clear or not? That's what he's asking. And next one, everyday workplace interaction. Everyday workplace interaction. So, what do you mean by everyday workplace interaction? At your office, at your hospital, clinic, home visit, meeting places, operation theaters, wards, outpatient, inpatient, emergency, wherever it is, every day, every place related to your medical field. So, how you are managing your discussions, your talks? Are you able to manage everything well? Or you are confused? You are happy with what you are doing? That is what it is. That, are you comfortable to talk and communicate with others? Are you able to pass on the information correctly? That is speaking. Are you able to understand what the other person is telling properly? That is listening. Are you able to write and pass on the information to the people who are far away from you? That is writing. Somebody wrote and sent to you. Are you able to understand very clearly? That is reading. The person who is in front of you, are you able to pass on the information you know to him successfully? That is speaking. Are you able to put into your brain what the other person wants to tell you effectively? That is called listening. Somebody is not in front of you and you want to write some information and send to them so that he understands everything clearly, because you cannot straight face to face talk to him, or on the phone you can't talk to him. So because you have any other busy schedules, you cannot. So you write a letter and send. That is called writing. And you cannot meet the other person, that the other person has to inform you many different things. He will tell about how to handle these things, nasogastric tube, or insulin injections, or many different topics. And everyone will not come and tell you. So what they do, they write and send. So are you able to read and understand which are there in the books, the information? That is reading. So everywhere it is the ability to understand when other person speaks, ability to understand and pass on the information to the other person, that is speaking. Ability to understand what somebody wrote, that is writing. Ability to understand what other person needs and send him that relevant information, that is writing. So that's it. All related to everyday workplace interaction. Everyday workplace interaction. So okay. So I told you, facts which are very, very important. Focus, attention, concentration, techniques, and strategies. So you have to apply all these things. I'm giving you a lot of strategies. Okay, I'm giving you a lot of techniques. But focus, attention, and concentration from your side. I'll give the bottom two things. That is, those are mine. But the above three things, focus, attention, and concentration, are yours. Okay. Now we are moving to part C. We are moving to part C. Yeah. So now from 8 it increased to 10. Very good. Okay. So is that clear regarding part B? Part B. Clear. Yes or a no? So we can move to part C. If you are patient, you stay. I'm not going to stop. I am not going to stop. If you are patient enough, stay. If you are not patient, you are a lot of work, you are a busy person, you have duty, you have many other things, you can go. Even if one student is there, I'm going to tell. Right. Part C. Now in part C, you hear two longer recordings. So what do you mean by longer recordings? That means in comparison with the previous ones, these are longer recordings compared to part B. Part B is extremely short, each one. Part A is moderate. So this is comparatively longer than part A and longer than part B also. Part B is very small actually, less than 2 minutes for each extract. And part A is 5 minutes for each extract. But here, so 10 minutes and 10 minutes, 20 minutes over. So 20 minutes, this is 10 minutes. This is 10 minutes for each extract. 10 minutes is too much. So 10 minutes and how many questions? 6 questions. But here the extract is for 10 minutes. In part B, the extract is only for less than 2 minutes. All the 6 are separate. Here 6 are together. They're all together. Part B is for 10 minutes. But here only one extract is 10 minutes. That is why this is longer. So now coming to the audio scripts. Each recording is either an interview or a workplace presentation. To tell you frankly, an interview is the easiest one when compared to workplace presentation. Because in interview, there will be two people talking, one male voice and one female voice. So it is easy to identify when the question is moving to the next one. But in a workplace presentation, it's difficult because only one person will be speaking and he'll be continuously speaking. And this is related to any particular topic related to the healthcare. So each recording is either an interview or a workplace presentation on a topic related to healthcare. So one that and one this, or both interviews or both workplaces, maybe either this or that, or both interviews or both workplace presentations, anything may happen. But if both workplace presentations, little tougher, because identification is very difficult. But normally, the first one, normally, the first one will be an interview and the second one will be a workplace presentation. Normally, according to my observation. And don't take Simon sir told like this. No. Majority, I can say. So, now you finish one recording and you go to the second recording. But you know that this is an interview, he will tell. If interview means you can relax a little. Because if the question is asked by a lady, the interviewer, reporter, or some other person, or a staff member, nurse is interviewing a doctor, anything like that. Then what happens? The genders will differ. Question male and answer female voice, like that. So it will be very easy to identify. But otherwise, if it's a workplace presentation, be careful. Okay. Now here, activity, what you are supposed to do. There are 6 multiple choice questions to answer about each recording. So, one recording for 10 minutes. Part A 10 minutes, 5 minutes, 5 minutes. Part B 10 minutes, 1 minute 40 seconds each into 6. And part C 20 minutes, that is 10 minutes, 10 minutes. And now 6 questions are there in 10 minutes. It will go on continuously. And there is no beep sound in the middle. Only one starting beep sound. That's all. Right. So there are 6 multiple choice questions and there will be 3 options. A, B and C. A, B and C. And what you have to do is, you have to listen very carefully and whichever you feel the answer, appropriate answer, then you have to tick that one. You have to circle that one black, make it black. Shade that one black. Right. Now the time. Part C lasts for around 15 minutes. Around 15 minutes. So around maybe 13 minutes, 14 minutes, or even 18 minutes, like that. So roughly like that. Not exactly. Around 15 minutes. So then it is 7.5 minutes, minimum 7.5 minutes. So you can think like that. So once you start here, there is a lengthy text and question is only one. Talking now 7.5 minutes. Okay, let us take like that. Okay, let us take only 6 minutes, suppose 12 minutes, suppose. Let us think like that. So 1 minute, more than 1 minute, he will be talking that one paragraph. That means very lengthy paragraph. More than 1 minute. That means too much information is coming. Too much information. And in that information, where is the answer you have to identify? Okay, it's a little bit trick of the game. So what you have to do is you have to be alert for this 40 minutes from the beginning to the end, especially in part C, because it goes away in disguise. If you don't read the questions and if you don't know what you are expecting, well in hand. If you are expecting a body part, when the body part is spoken, immediately you can write down. If you don't expect anything, then what you will guess for? So this part lasts around 15 minutes. So you have to guess and be ready. Because passage is lengthy and only one answer. So you don't know in text, in part A, passage is small and the answers will come immediately. Within 30 seconds or 20 seconds, one answer will come in part A. But in part C, one answer will come in roughly 2.5 minutes or more than 2 minutes. Okay. So it's very lengthy. You'll be getting mad. Where is the answer? Where is the answer? Where is the answer? You'll be getting mad. You'll be getting irritated. And you will dig here, drag here, pull there, trick you, that, this. First of all, I wanted to take a medication. But I went for physiotherapy. So he's telling, I wanted to take medication. But my father suggested, better not take medication and try to adopt some other positive, instead of medication, try to adopt some other treatment plan. Then I consulted 3 or 4 people and they gave me, some told go for Ayurveda and some told go for English medicine and some told no need medicine at all. So like that he will be pulling that, this, that. Suddenly he will tell the answer. And if you are not alert, you are gone. So be careful. That is what happens. Okay, that's what happens. I'm going to give you a lot of, okay, I'm going to create 1 page for part B and 1 page for part C separately for listening. Like B, similar to B, I'm going to give you for listening also. Yeah. And the audio also will be there. When you click on the video there, okay, I'm going to place it in the YouTube and you can click on that one and every individual things you can do there. Right. And you can write the answer also there. You'll get the answer also there immediately. You can check like how reading you are able to do like that. I'll give for listening also. So now here, I'll ask you one question. You are doing reading sessions and immediately you are getting answers. I created a channel for reading B and reading C. So reading B and C, answers you are able to go to the channel, answers able to get. Nobody needs to give you. You need not ask anybody. Get. Okay, immediately. So, is that technique useful? Technique, that poll technique useful? Yes or no? Yes or no? Hello, Dr. Sandra. Good afternoon, dear. Yeah, all of you, come on, give your poll. Yes or no? Yeah, tell me, sir. What is the time now? 12:15. You should have told me morning itself I took leave, so I would have arranged the morning. Okay, now morning I'm tight till 2 or 2:30 or 3. Before that, but I'm full tight. If I'm free, I'll let you know. But you tell me your time after 3 or 4 or 5. 3 is okay. Okay, 4 o'clock is okay or 3 okay. Anyone you tell me. 3 or 3:30 or for anyone? 3 o'clock. Make a timetable for Saturday, 3 o'clock. Okay, Saturday. So, Shahjadi, 3 o'clock, writing. Okay, for IELTS, 3 o'clock. So, now, do you want the same technique for listening also? Listening also. Do you want? It takes me a lot of time and pain. I'm cutting, editing, and lot of things I'm doing. But do you want? Say yes or say no. If you say no, I'll be very happy. But if you say yes, I'm ready to do for you. Because you are sweet little children for me. So I'll post and you can definitely hundreds of question papers I'll put there. And you can go there and you can do every time, whenever you want, you can go and do the question. One question, do 10 questions and leave. Afterwards, another 5 questions. When you are not free, you do one question or you don't do it all. That is your wish. From question number 1 to question number 1000, you can do anywhere, how many you want. So, right. Along with the answer there itself, I'll create a video and I'll put there. You just click on that one and you give the answer. Finished. It will play there. Right. Okay, many people said yes. Very good. I'll do that one for you. Right. So print the screen. So this part lasts for around 15 minutes. Yeah. Next. Right. Yeah, objective. What is the objective? Now here part C, what is the goal? What is the orientation? What is the end result for this one? What is the expectation or aims and objectives? That is the ability to understand the speaker's ideas and experiences related to the topic. Part C is testing the ability to understand the speaker's ideas and experiences related to the topic. So please be clear there. So he is telling you idea. Idea is explaining. It is not so easy. So when somebody is telling ideas and experiences, it's not so easy. You have to live in the shadow of the other person who is speaking, and then only you can understand. Everything from the beginning to the ending, you have to listen. Then only you can understand. It's called something like summary. Okay. After telling everything, what is he thinking? Is he trying to help? Or is he telling the drawbacks? Or is he telling to avoid it? Or is he telling to implement that? What exactly is intention? So these are ideas, intentions, and experiences related to a particular healthcare topic. Now I'm going to give you some instructions. Now till now I have told you some things about. Now I'm going to tell you about in the text. In the question paper, what you will be there. What you will be finding there. You will find instructions and questions. Now first let us talk about instructions. Before each recording, is played, there will be instructions. And you hear the information about the context and instructions about what you have to do. So, instructions are there. It will tell you do's and don'ts. It will tell you what you are supposed to write. It will tell you what you are supposed to listen. It will tell you what they are expecting, OET is expecting from you. So there are instructions regarding what you are supposed to do. And this information comes from the audio script. So you have to listen there, listen to that, and then follow the instructions. This happens before the actual recording. Before. Then he will give you some time to read. Then he will ask you a question. Beep sound comes. Then the listening comprehension starts. So that is how it is. So it will tell you how many words you can write. It will tell you how much time you have. It will also tell you how much time is there for your preparation. How much time will be there for you until the beep sound is there, until it beeps. So like that. The information will also be printed on your test paper. Okay. Not only in the audio recording, directions, instructions, not only from the audio, whatever he has written, it will be there on the paper also. Whatever is written on the paper, it will come from the audio also. That means they have written for you to read and they are speaking for you to listen. If double power, that means it is very important. That means you should not miss these things because you know what to do and how to do and why to do regarding the extract based on these instructions. If you don't understand the instructions properly, then you will not reach your destination. Okay. Now you are asking instructions to somebody to tell you how to go to the airport. He says, turn left, go straight, turn left, walk for 2 kilometers, then turn right, and again turn right. There at the corner, you will find the airport. So if you follow 100%, then you will reach your destination. Any one particular bit of information you don't read, somewhere you will go instead of somewhere. That's it. If you said walk for 20 minutes, then there will be something else. And after 10 minutes only, you will take the turn. You will go somewhere else. Now, pre-listening. I told you already this one. Pre-listening. Before each recording, until the beep sounds, you have time to read through the questions. Before each recording, you have time to read through the questions. You are supposed to study them. Study the questions, underline the keywords, circle the most important words. Okay. Then you do the skimming and scanning. Many people don't know what is skimming and scanning. How we are doing skimming and scanning. What is meant by skimming and scanning? That also we are going to see today. Okay. So you have to read. For example, there are some special names. What for you have to skim and scan? If there are some special names, okay, then you have to underline with capital letters or some special names with capital letters. Then you can underline. They are easy to identify. Capital letters are easy to identify. National Research Survey Program. Like that. So capital letters N, R, S, all these will be capital letters. So you have to notice those capital letters and you can underline them. Next, you have to underline numbers. You have to underline numbers because numbers are very important. Numbers are different. They have a different shape. They are totally different from the words. They are stand out from the crowd because they are taller than the small letters. So, wherever number is there, just underline. If you underline these things, you need not read anything. If you underline these things, you need not read anything. So don't read. Only people who are not proficient, who are not wise, they read too much. See, for example, there is a power station, electricity power station, and there are a number of electricity engineers. It is filled with engineers, right from chief engineer, okay, and senior engineer, junior engineers, assistant engineers, deputy engineers, and professional engineers or trainee engineers. The number of engineers. And then what happens here? Suddenly there is a short circuit and everything becomes black and nothing. And it's the middle of the night. The power station is open and all the engineers are there. Then, so no electricity. Okay, it is daytime also, no problem. No power. Short circuit somewhere. We don't know what happened. Okay. We don't know. Then what happens? The new recruits, the new recruits, they don't know anything. They'll be in panic. They'll run here, they'll run there. They'll try to check every fuse, plug the wire, okay, holder, everywhere. They will start searching what happened. They'll just run here and there and they'll make a mess of everything because they don't have experience. Just fresh come to duty. They don't know anything about the platform. So that is how they behave. Now, senior engineer. Senior engineer, what he does? Okay. He calls somebody of the power control room. He calls that person and tells him. So what he tells, listen, there are 5 bulbs. Now you get up from there, go to the left side, there is one chamber. There are 5 red lights. Now look at them and tell me which of the 5 is not glowing. The rest 4 are on, but one may not be glowing. Yeah, not on. Which is that one? You tell me. The first one or the second one or the middle one or the 4th one or the last one? Which is the one? Then he will go there and he will check there. Okay. And but before only, he will not inform him anything, senior engineer. And he tells like this, go to that bulb, below that bulb there will be one switch. You just put off that switch, remove the fuse, replace the fuse, push it in and switch on again. That's it. Shall I call you, sir, after the work is done? No need. Complete it and leave it. Because I myself will know whether everything is perfect or not. So why should you call and tell me? So much relaxed. So this is senior engineer. Immediately cause panic. Then the chief engineer, he will sit in his place. Okay, he'll just press the bell and the senior engineer will come into his chamber and he'll say, go and look into the matter. That's all. Because he knows that he will do it. He's relaxed. Are you relaxed like that? Are you confident like that? So if you are expert, you will know what you have to underline, you will know what you have to circle, you will know what you have to highlight. So names are important, you have to skip the names. How do you identify? Through your capital letters. Whenever capital letter is there, that underlining. We have seen so many sessions. Next, numbers are easy. How easy is it? You can identify easily because of their standing out nature. They stand out of the words. Very easy to identify numbers. They look different because of their shape. Next, number 3, new vocabulary, difficult vocabulary, and special words and phrases. All these are big words, not small words. Big words are difficult to understand. So try to understand those things. So these are the 5 different things you have to underline. So skimming. Not skimming, scanning. Skimming means title and subtitle. That is it. But scanning is something different. Names, numbers, new vocabulary, difficult vocabulary, and special phrases. And special phrases. Okay. Okay. So, right, you have names, numbers, new vocabulary, difficult vocabulary, special phrases. So these are very important. So if you underline these things, answer will be among them only. If you underline names, you will get 50% of the answers. If you underline numbers, you'll get 20% of the answers. New vocabulary 10, difficult vocabulary 10, special phrases 10. So totally 100% you'll get the answers. 100% you'll get the answers. So after pre-listening, you'll do the guessing part. You'll do the guessing part. Think about what you are going to hear before you answer the questions. So, guess. Guess. What are you going to hear? Are you going to hear something related to something? So, advantages or drawbacks or causes or effects or a situation or a medication. About what is the scenario? Just guess. You have gray matter. The brain is working. So you have to guess properly. Reason, logic, and understanding, not blindly. So think about what you're going to hear before you answer the questions. So the audio comes, but before that you have to time. So there you have to guess. Is he going to talk about medication? Okay. What is the disease? Hypertension. So what are the names of the medication? Maybe guess this or this or this. So if you guess, you'll get the answer probably 90%. How to guess? Let me say. A. A means what you can guess from there. He had A. A means what? He had A. So A. A means article. A comes before noun. And it is singular. It is not plural because A is there. See how much I am guessing. A means common noun, not proper noun. Proper noun means Hari is a proper noun. India is a proper noun. Himalayas is a proper noun. That means unique name they have. Simon Peter is a proper noun. Abraham Lincoln is a proper noun. Margaret Thatcher is a proper noun. Samsung phones, proper noun. So like this, a special name is there. Special name. So those are proper nouns. Common names. So common noun. Boy, phone, hospital, teacher, school, pen, book. These are common nouns. So whenever A is there, it is a common noun, not a proper noun. A Hari, A India, an India, nothing like that. So you will have common noun. And because A is there, singular, a book or a table, not tables, not books. So we know S will not come. We know name of something will come. A is there, after that something will be coming. A book, a pen, a doctor, like that. An is there, an officer, an engineer, but not an teacher, an lawyer. No. Why? Because N is there, A and an. So the next word will be well, an engineer. It will start with the sounds of A, E, I, O, U. So you have to guess. You have to guess unless and until you activate your brain cells by brainstorming. Okay, there are chances that you may miss the answer. You are waiting for the answer, but the half of the answer is there in front of you, and you ignore that and you just want to wait for the audio. It's waste of time. Next one. Yeah. that is done and dusted. Okay. So this is part A. We have completed the first round of the session. Right. So we are going for yeah. Now I am going to ask you one question. Be ready what type of question I am going to ask. Okay. So one question before we plunge into the real action. This is the training part which I have done now. So thanks for participation, and that was a really good session because I taught because I love teaching. Many people do not attend because they do not love learning. That is not my problem. That is their problem. Let them deal with it. But those who really love learning, they will be attending. Even if it is one student. If no student is there also, I would have taught. No problem for me. Okay. So what I want to ask you now is print the screen. Yeah. Right. Finally, 8 students are there. So before going, I'll ask you one question. So today afternoon, today I have given workshop for listening. So we have reading session today afternoon. I'll tell you the time. So be ready, be available anytime. So how many of you are interested? Just interested, say yes. Not interested, say no. We are going for the reading in the afternoon. Yeah, 4 in. Good. Okay then. You can give a feedback. You can give your feedback in 2 or 3 sentences. Your feedback and suggestions. feedback regarding the session. So after 2 minutes, this will close. అరే అది కట్ చేస్తే కట్ చేసిన ఇది కట్ చేయాలి మరి నువ్వు కొలత ఏం తీసుకున్నావు మనం తిన్నావా కొలత తీసుకున్నావు కొలత తీసుకొని పోయి మరి ఏం కొలత తీసుకున్నావు రెడీమేడ్ డబ్బులు తీసుకొని ఇక్కడ పెట్టేటట్టు ఉండాలి కదా అవునా కదా ఎక్కువ కాదు ఎట్లా రూపాయలు కాదు అది మంద తక్కువ అది పూర్తి కావాలి పోషించుడు ఎంత పోషించడు బాగా పోషించు మరి So Rose and Usha. Okay. Right. So to all the viewers, if anybody is interested, you can ask me. Listening or reading the YouTube channel, whoever is watching. So we have special training sessions for listening separately, reading separately, writing separately, and speaking separately. I'm going to show you. Yeah. Yes. So here it is. This is the fee structure. Yeah. This is the fee structure. So those who are interested, you can contact me. Only writing for 1 month is 5,000 Indian rupees, especially for the Middle East and other nationalities. I'm telling you, this is Indian rupees. Indian rupees. So 5,000 rupees. And only speaking is 5,000 rupees for 1 month. So writing, you will have 30 to 50 letters corrected. 30, it is approximately 100 rupees per letter. Okay, normally individual letter I charge 250 to 300 rupees, one single letter. But if you are taking for monthly basis, it is 5,000, minimum 30 and maximum 50 letters you can get corrected. From the starting date to the ending date, it's 1 month. Within that 1 month, you have to avail. And speaking, 5,000. So you will be doing almost 10 speaking role plays per day, practice fluency, and 1 or 2 speaking sessions with me, that is with feedback and correction and evaluation. So every day, so 30 sessions you will have with me minimum, and 60 maximum. Okay, daily 1 or 2. Initially I'll give 1, but afterwards exam time I'll give you 2 for last 20 days, 15 days. So 60 sessions, 45, 50 to 60 sessions you'll have. The next one, reading, daily 1 reading, that is 3,000 per month. And we'll learn all the techniques. Those who are facing problem, nobody is teaching reading, nobody is teaching reading. We are very sad, nobody is helping us. For such people, you can join. It is 3,000 per month. We'll do 1 reading every day. And listening, also 3,000 per month. So we'll do 1 listening every day. And your doubts will be clarified. Okay. Doubts will be clarified gradually, one-on-one sessions. And then complete full course, 1 month. 1 month complete course, all 4 skills is 10,000. So you'll be saving 6,000 there if you take full package. And complete course is 100 days. That means 3 months and 10 days. That will be 15,000 Indian rupees. So we have coming batch, we are starting on Monday, new batch. Okay, new batch. So because of some vacancies, 1 nurse is going to Saudi Arabia. She's shifting, she's going, and there are 2 or 3 other students. Okay. So they plan to start next week. So we are starting a new batch. 7 students only we need. 7 students. So if anybody is interested, you can take 1 month course, all skills, that is 10,000, or full course, that is 15,000. So you save a lot of money when you register together. You just pay 5,000 extra, and you will get 30 days, 70 days extra. 30 days is 10,000. After that, 70 days is only 5,000, because I teach a lot of things in the first 1 month. So all the other days, I don't need to take much money for that. So it is just 15,000. So if anybody is interested, and here is my number. My WhatsApp number. Okay, I'll give you my WhatsApp number. WhatsApp.me. So this is my WhatsApp number. Okay. Copy link. So this is my WhatsApp number. So you can contact me. And here is the Telegram channel, which tells you about the fee that I will direct once again. So, here it is. I will direct to the Telegram channel once again. So interested candidates can contact me. So I prefer full course so that I can prepare you 100%. So those students, you can contact me personally. And if you are not serious, please stay away from me because I am not okay. So I cannot play the fool. So that's it. So I'm a little bit serious kind of teacher. I want my students to learn and go for the exam. So if you are a kind of person who is not very serious, then you can definitely stay away from me. Yeah, right. Contact for admissions. 7 places for nurses. Okay. So, okay. Contact for admissions. Yeah. So this is the contact for admissions. This is Peter Simon. Contact for admissions. Peter Simon. Celta, Cambridge. Cambridge University. Okay. M.A. Med. Right. Fine, that's it. And now positions. We have the positions here. So we have the positions here. What is it? Okay, that is for nurses. For doctors, it is different. Doctors is 25,000. Nurses and doctors. Nurses and doctors. This is admissions. Admission notification. Admission notification. Okay. Admission notification, nurses, 7 places, doctors, 3 places, nurses, 7 per batch, 7. Okay, so शायद है ना Facebook का 15 నిమిషాలు ఒకటిన్నర గంటలు. So structures. David.
times. నిజంగానే పని ఏం కట్టుకోండి మీ పిల్లలు బాగా ఇస్తాను పెట్టుకోండి చెప్పండి సార్ జాగ్రత్త ఆత్మహత్య ఓ రామశంకర్ మన అయినట్టు ఏమైనా లేను నువ్వు లేవలే లే నడువు లే రైట్ రా తొక్కని నడు నడు నడువు 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 అనగా నడువు 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 ఇలా కావద్దని చెప్పినా కదా నేను ఏయ్ నడట్లే రావద్దంటే నచ్చుడు ఏమైనా ఉన్నాడు వచ్చిందంటే వద్దా నువ్వు తప్పు నోట్లోకి వచ్చిందంటే చూడు చెప్తానా
హలో, గుడ్ ఆఫ్టర్నూన్ అండి. ఏంటి? నేను రాపిస్తున్నా, చెప్పి రాయనమ్మా. ఎవరైతున్నారు? నీకేమన్నా చెప్పినా నా ఎప్పుడన్నా? నేను అన్నీ నీకు చెప్పినా, నీ ఇష్టం నాన్న అని చెప్పినా. నువ్వే రావు. నువ్వే చూసుకోవాలి. మరి నువ్వు కాదు, పక్కింటి వాళ్ళు చూసుకుంటారా? చెప్పు. సరే, నీ ఇష్టం. చూడు ఎట్లా చేస్తావు చెయ్యి. అర్థమైందా? ఎట్లా చేస్తావు చెయ్యి. రోజు 2 లెటర్లు రాస్తా. రాయి. వద్దేనా నేను? అదే నీకు ఏది ఉన్నదో నేను ఫాలో అప్ చేస్తా కదా. నేను ఫాలో అప్ చేస్తా. నువ్వు అడిగేది ఏమున్నది? నీ ఇష్టం. నువ్వు ఎన్ని చేసుకోవాలనుకో అన్ని చేసుకో. నీకు ఏం చేయాలనుకుంటే చేసుకో. నేను చూస్తా కదా, చెప్తా. తప్పకుండా చెప్తా. ఓకే. నీకు నచ్చినప్పుడు రాయి, నచ్చినప్పుడు వదిలేయి. ఎప్పుడు చేయాలని చెయ్యి. నష్టం ఏం లేదు అంటున్నాను. సరేనా? ఓకే. చేసుకోండి.
3 o'clock సాయంత్రం చెప్పింది సార్ ఒక అమ్మాయి. ఏమో సార్ అమ్మాయి చూడండి.
Manju, Manju, three things I want to talk to you. Okay. Number one is Sandra. Okay. You can ask Sandra if she's available now for class. If she is available, we'll take a class. Okay. Right? Combined class. You can inform. First, you ask Sandra if she is available now. So the next half an hour to 45 minutes, we'll take them. Number one. Okay. Number two. What is that? Salaries. Okay. Salaries are getting a little delayed now. Okay. So most probably we'll get a day after tomorrow only. Okay. So I did not, I had some emergency, so I could not follow up with the classes. Okay. So if possible tomorrow or day after tomorrow. Okay. Right. So next one is, what is that? Tea. Okay. Tea after morning you did not get, na? So how much is that money? Okay, calculate that one, and we can give no problem. See, anyhow you will take, if not today, tomorrow you will take, right? Correct or not? Hmm? So no problem. Now afternoon, no, Sampath will bring you. Okay. Now, what is his name?
Sampath.
Sampath. Sampath. Sampath will bring. Okay. Afternoon. Morning he was not there, so that's why I told you. Okay. Okay. Hmm? Follow it up, please. Huh?
നിങ്ങൾ വിളിക്കുന്ന വ്യക്തി ഇപ്പോൾ മറ്റൊരാളുമായി സംസാരിക്കുകയാണ്. നിങ്ങൾ വെയിറ്റ് ചെയ്യുക അല്ലെങ്കിൽ പിന്നീട് വിളിക്കുക. आपने जिस व्यक्ति को कॉल किया है वह अभी दूसरी कॉल में व्यस्त है. कृपया प्रतीक्षा करें या कुछ समय बाद कॉल.
Good afternoon, John. How many letters are there with you now? Why? Okay. Okay. So today you cannot correct them, right? Okay. You have classes, no? Huh? You cancel the classes for 2 days, but I am still troubling you, no? Okay. Okay, fine. Okay, fine. Okay, fine. Okay, dear. Okay. నాన్న ఫోన్ చేసిన పైసలు ఇంకా రాలేదు నాన్న. ఏది కట్ అయింది? ఎంత? 1000 రూపీస్ ఉంటుందా? అది ఎప్పుడు కట్టాలి? టైం ఉందా దానికి? మళ్ళా కట్ అవుతుంది. సరే, ఎవరినన్ను అడిగి తీసుకోరాదు నాన్న. 3-4 రోజుల కోసం నేను ఏర్పాటు చేస్తాను. వెంటనే అయ్యేటట్టు కనిపిస్తే లేదు నాకు. ట్రై చేస్తే నాకు కొత్త అడ్మిషన్స్ తీసుకుందామని. 3-4 రోజులు పడుతుంది. ఎవరి దగ్గర తీసుకో. మా నెక్స్ట్ వీక్ ఇస్తానని చెప్పేసి తీసుకో, నేను పంపించేస్తాను నీకు. నాకు ఇప్పుడు గుర్తున్నది కదా, తీసుకొని పంపించేస్తాను. ఏమైనా ట్రై చేసి అడిగి తీసుకొని కట్టేస్తాను. నేను పంపిస్తాను నీకు, మొత్తం పంపిస్తాను. సరే, మా అమ్మ వచ్చిందా? ఎక్కడ ఉందా అంట? సర్లే, ఓకే మేడం. Hello. Good afternoon, Sina. Which card you want to do? Yeah, you prepare, no problem. Okay, the thing is, that I was sent for the typing and they are ready now. You will get the letters today and I will give for feedback also. And every day you write 2 or 3 letters. On the same day, you will get everything. Okay. Somehow you. I will explain you. I will explain you. No problem. So today I will arrange a session and I will give you feedback today. First we'll start with speaking. One by one we'll do, no? Just you say, sir, you say, then I'll follow it up. Don't be silent. Okay. See what happens, for example, no, what happens is if I am, see, you say, sir, give me correction. Then if I am busy, then I cannot attend you. I'll say, I'll call you afterwards. Then afterwards, just you can remind me, sir. So then I will remind, no, see, now you called me, you message me. So I call you, no, like that. Okay. No problem. Yeah, no problem. Now 15 days are still there. Double you can do, no problem. Okay. So prepare one card. First send me the card. Then prepare the card and call me. 3 minutes. Then what you want now? Then. Oh yeah, writing I'll give you. I'll call you. I told, no. Writing. See, speaking means 10 minutes finished. But writing means at least half an hour I need, na? Correct or not? So we'll set that one. We'll do today. Definitely we'll do today. Okay. But definitely we'll do today. Now what you can do is in the meantime, you can do one reading or listening or another writing and send me, no problem. What you will get, those today you are going to get, na? I already corrected. See, let me tell you one thing. Now I have corrected till where means the number is, okay, I have corrected till 200, 4,200, and your number is 5, okay? 205, okay? Another 5 letters, your letter will come, na? Right? You understand? All the things together, they will come. Okay, no worry. From today you will get. Now what you can do is you can write another 2 letters. Don't worry. That anyhow you are going to get those 3 letters. Yeah. No problem. I'll do that one now. Huh? Okay. Fine. Okay, you do one thing. Take 1 letter and do. Modify your letter. After that, you write 2 letters. You modify it. Now you write 1 letter and send me. Okay. Now you write 1 letter and send me. If you write 1 letter and send me now, I'll give you the feedback on the spot. Okay, fine. We'll change the style a little. Okay. Okay, dear. Manjuni, phone ji. ఓరిని ఎంకమ్మ నీ గొంతు పొడగాను. Mental. I hate you. నేను ఎవరెవరు ఉన్నారాడా? వాళ్ళిద్దరు ఎందుకు రాలేదు? వాళ్ళు ఏమని చెప్పినారు? వేరే పని దొరికిందంట వాళ్ళకి. మరి వాళ్ళు సరిగ్గా చెప్పాలి కదా మరి. అందులో ఏందని అర్థమవుతుంది నాకు. మేము వేరే పనికి వెళ్ళిపోతున్నాము అన్నట్టు అర్థమైంది నాకు. నేను ఓకే అని చెప్పిన. అర్థమే వీళ్ళకి అర్థమైందా? వీళ్ళ ఇంగ్లీష్ ఎంత నాకు అర్థమైతలేదు. చంపేస్తున్నారు నన్ను. సరే ఓ పని చేయి, నువ్వేం చేస్తావంటే ఎవరున్నారు, ఎవరినైనా ఒకటి తీసుకొని ఇంటికి వచ్చి నీ లవర్ని తీసుకొని వచ్చి. ఇప్పుడు ఎవరున్నారు అక్కడ? నువ్వు 15 నిమిషాలు రారాదు వేరే నన్ను తీసుకొని. ఎవరైనా 15 నిమిషాలు తీసుకొని రా, అకౌంట్ బుక్ తీసుకొని రా. శాలరీస్ కూడా చూద్దాం కదా. అది నాకు శాలరీ రోజు అనుకుంటాం, అడుగుదాం అనుకుని మర్చిపోతా ఉంటాను, నాకు మైండ్ నుంచి పోతుంది. తీసుకొని వస్తావా? సరే 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 సరే. సంపత్ అక్కడ టేబుల్ తీసుకో, చేప తీసుకోండి. పండుకున్నారా ఇల్లేనా? పండుకున్నారా ఈ పిల్లలు? అయితే తీసుకురాకు, దుప్పటి దుప్పటి తీసుకొని. ఇక్కడ ఉంది దుప్పటి. నువ్వు కూర్చో, నువ్వు కూర్చో, నీ పని నువ్వు చెయ్యి, ఆయన పని ఆయన చేసుకుంటాడు. ఏమైనా మీరు డిపార్ట్మెంట్ చేంజ్ చేసుకోండి కాబట్టి. కిచెన్ ఆమెను చూసుకొని మిగిలిన నువ్వు చూసుకో. అదే కిచెన్ మామూలు పని ఆమెను చూసుకొని, ఆమె చేసుకుని మిగిలిన నువ్వు చూసుకో. అదే కావాలి మిగిలిన అంటే వేరే విషయాలు, ఈ చెట్లు నువ్వు చూసుకో. అదే ఇద్దరు కలిసే చేసుకుంటున్నారు కానీ. శాండ్రా, not 3 p.m. I thought I asked Samantha to call you and tell you. Did she tell anything? Now only we can finish up, I was thinking. Yeah, okay, fine. I'm sending the link. ఎవరన్నా ఆమెను వంట కొంచేసి కొద్దిగా మనకి చేయి తిరిగింది అనుకో, ఇంకొకరిని పెట్టుకుని ఆ గిన్నెలు కడగడానికి చట్నీ చేస్తే. నాకేంటి అని అంటే వంట చేసేటోళ్ళు వేరే పని చేయకూడదు. ఇక మనకి ఇప్పుడు ఎవరు మనకు అంత లేదు కదా, ఇప్పుడే భారం అవుతుంది కదా, అందుకని సరేలే అయిపోయేదాకా. అంతేనే కదా, కిచెన్లో పని చేసేటోళ్ళు వేరే పనులు ముట్టదు నాకు. అది గిన్నెలు కడుగుడు ఇవన్నీ చేయకూడదు. ఏమన్నది ఒక 1000 రూపాయలు అయితే ఎవరన్నా వచ్చి చేసుకుంటారు దానికి. అంతేనే కదా. ఏదో ఒకటి చూద్దాం చిన్నగా. నువ్వే చూడు, ఎవరైనా మంచి వాళ్ళు ఎవరైనా దొరుకుతున్నా వచ్చి ఒక అరగంట గంట వచ్చి, లేకపోతే మన ఆఫీస్లోనే ఉన్నది కదా, ఆమెను ఒక గంట రమ్మంటే అయిపోతుంది కదా. అట్లా లేకపోతే నువ్వు చూసుకున్నావు చూద్దాం తర్వాత, వచ్చే నెల చూద్దాం. వచ్చే నెల దాకా కొద్దిగా మేనేజ్ చేసి కొద్దిగా ఈ నెల సెట్ కావాలి నాకు. కొద్దిగా అదే బరువు అయిపోయింది ఈ నెల, ఎందుకో మరి నాకు తెలియదు. సో నెక్స్ట్ ఛానల్ చూద్దాం. తర్వాత వారంకి ఒక్కసారి అన్న కానీ పైన శుభ్రం చేసుకోండి. నేను చూపించిన ఏరియా మాత్రం రోజు చేయాలి, ఎందుకంటే నేను రోజు పోయి కూర్చుంటా రాత్రిపూటిగా. చిన్నగా చేద్దాం, రోజు అడుగు కాదు, చిన్నగా చేసుకుంటాం. కిందేమో కూర్చోం కదా మనం, కింద కూర్చున్నది ఏం లేదు కదా, గాలికే కదా. ఏమన్నది చైర్ వేసుకొని పోయి ఒక అరగంట కూర్చున్నాం అనుకో, చిన్న 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 అట్లా అయిపోతుంది. రోజు ఇక్కడ ఉండేసరికి నాకు ముసమార్ నదులు అయిపోతుంది. నేను పైకి షిఫ్ట్ అయిపోతా, పైన చేసుకుంటా, మంచిగా చేసుకుంటాను. ఆ రేకులు తిప్పించేసి మంచిగా స్లాబ్ వేయించేస్తాను అనుకుంటున్నాను. కానీ వెంటనే నేనేం చెప్పట్లేదు, ఎందుకంటే ఒకటేసారి అంటే కష్టం అవుతుంది కదా. నేను ఒక్కనేనా అన్ని నేను చూసుకోవాలి కదా, అందుకని కొద్దిగా భారం కాకుండా చిన్నగా చేసుకుందామని ఆశ అయితే ఉన్నది, చేపియాలని. అందుకు పర్మిషన్ తీసుకోవాలి.
అవును సార్, తీసుకోవాలి సార్. రేపులకైతే అవసరం లేదు కానీ స్లాబ్ కి పర్మిషన్
తీసుకుందాం.
పర్మిషన్ తీసుకోవాలి,
పైసలు కట్టాలి దానికి.
గ్రామ పంచాయతీ వాటి నెక్స్ట్ కానీ ఇప్పుడు డిస్పాట్ అవుతుంది.
లేకపోతే ఒక పని చేయి, మీరు ఇక్కడ ఉండండి, నేను వేరే ఇల్లు తీసుకుంటాను. కొత్త ఇల్లు ఏదైనా ఉన్నదో చూసి తీసుకొని పండుకోవడమే కదా, మా ఆఫీసర్ పెట్టుకుంటాను. నువ్వు తీసుకొచ్చి నాకు ఇవ్వచ్చు. మీరే ఇక్కడ ఉండండి. వాళ్ళు మంచి వాళ్ళు వస్తానంటే మంచి వాళ్ళని ఇక్కడ ఉండండి, వచ్చిపోతారు. అన్నారా? ఇక్కడనే తినొచ్చు వాళ్ళు, ఇక్కడనే తినొచ్చు, వంట కూడా ఇక్కడనే చేయొచ్చు వాళ్ళకి కావాలంటే. అన్ని మంచిగా చేయాలని ఉన్నది కానీ కొద్దిగా నాకు చేతులు తిరగడానికి కొద్దిగా టైం పడుతుంది. నాకేంటంటే ఈ పని మీద కూర్చుంటే నాకు పైసలు ఉంటాయి, నాకు వేరే పెట్టుకుని అంటే నాకు ఇంకా దిమాగ్ ఖరాబ్ అవుతుంది, అంతే నాకు ప్రాబ్లం. అది కూర్చున్నాను అనుకో, ఇట్లనే కూర్చున్నాను అనుకో, నాకు సపోర్ట్ ఎవరైనా నుండి మంచిగా కూర్చున్నాను అనుకో, ఈజీగా 2 నెలల్లో మళ్ళీ మంచిగా చేసేస్తాను.
ఇయర్లీ ఓవిట్ ఎగ్జామ్స్ ఇంటర్న్షిప్ సార్, ఓవిట్ ఎగ్జామ్ ఇంటర్న్షిప్ ఇయర్లీ
నెలకు 2 సార్లు నన్ను వదిలిపెట్టి ఎవరు పోరు, నా దగ్గరికి వచ్చిన తర్వాత సాధారణంగా ఎవరు పోరు. ఇది లేకపోయినా కానీ నాకు వస్తూనే ఉంటారు. ఐఎల్స్ ఉన్నది, పీటీ ఉన్నది, నాదన్నీ కాంపిటీషన్ ఎగ్జామ్స్. ఫారెన్ పోవాలంటే కావాల్సిందే, ఫారెన్ పోయే వాళ్ళందరికీ డబ్బులు ఉంటాయి. నేను ఎవరు ఎక్కువ ఇస్తారో వాడికి తీసుకుంటా, అంతే. నేనే ఫీజు ఎక్కువ చెప్పి తీసుకుంటా. తర్వాత ఏదో చెప్పా, నువ్వు పని చేయి, ఈ నెలలో నువ్వేం చేస్తావంటే మనకి ఫర్నిచర్ ఫ్లాట్ చెప్పు, ఏ ఫర్నిచర్ అయితే బాగుంటుంది, సోఫా సెట్ అన్ని. ఇది ఆఫీస్ రూమ్ చేసుకోబుద్ది అవుతలేదు నాకు, ఎందుకో నచ్చట్లేదు నాకు, గాలి వస్తలేదు, అది ప్రాబ్లం. గాలి వస్తలేదు, ఆ కిటికీలు తీసే, కిటికీలు తీసే. ఇంకోటి టీవీ పెడతా ఉంటుంది, ఆ తలుపు దిద్దంటే టీవీ పెడతా ఉంటాడు అదొకటి అన్న
అన్న ఇంటికి పని ఇంటికి పని
అవు మీరే డార్లింగ్ నువ్వెందుకు వచ్చినావు గుండు నువ్వెందుకు వచ్చినావు తోకలెక్క వచ్చినావు చింతకాయలు తీసుకెళ్ళడానిక చింతకాయలు దొంగ నువ్వు కూడా తీసుకెళ్ళా నేను ఒక్కతే అనుకున్నా చూడు శాలరీ చూడు నాకు స్టాక్ తప్పిందమ్మా నాకు మైండ్ లోంచి పోయింది నేను అన్ని పనులు పెట్టుకున్నాను క్లాసులు తీసుకోకుండా అయిపోయింది 2-3 రోజులు ఆ మోరి గురించి నాకు మెంటల్ ఎక్కిపోయింది నాకు 2 రోజులు అది తెరిచి పెట్టినాము అదొకటి అయిపోయింది చూడు ప్రతిసారి ఫస్ట్కే ఇస్తుంటే కదా శాలరీ వద్దు 7th అంటే కానీ ఫస్ట్కే ఇస్తుంటే వాళ్ళు లేట్గా చేస్తుంటే మనం ఏం చేస్తాం ఫస్ట్ ఇచ్చేస్తుంటే నాకు అక్కడనే బాగుంది నేను ఆడికే పోదు మీరే ఇక్కడికి రండి నాకు పీస్ ఆఫ్ మైండ్ ఉంటుంది వీళ్ళు కూడా మా ఆటికి పరిశాన్ చెప్తున్నాను నేను తిను 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 చంపుతున్నారు కదా తిను సార్ తిను అంటున్నాను పొట్ట పగులుతుంది నాకు మేడం కూడా తిను 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 అంటే తప్పించుకొని తినవద్దు కాదు నాకు ఎక్కువ అది తాగడం అంటే తాగుతాం మస్తు తాగుతాం పెప్సీ ఫుల్ బాటిల్ అంటే డ్రమ్ అయితే సరిపోతుంది పెప్సీలు ఐస్ క్రీమ్ తీసుకురా తినబుద్ధి అవుతుంది ఇలా ముందు ఇలా కూర్చోబెట్టి ఇలా చూపించుకుంటే తప్పించుకుంటే పెట్టుకోండి నీకు నస్తుంది నాదేమి నీకు నాదేముంది ఇదేంది ఇంటర్నెట్ వస్తుంది వాట్ ఈస్ దిస్ సో ఫార్ ఇంటర్నెట్ ఈస్ గోయింగ్ ఆన్ ఇట్స్ గోయింగ్ ఆన్ I did not see. Very sad. చెప్పు నాన్న ఐస్ క్రీమ్ హౌ మచ్ ఇస్ ద అడ్మిషన్ ఫీ ఫర్ డాక్టర్స్ చూడు ఇంతలో కూడా అమ్మ అన్నదే కానీ అయ్యా అన్నదా అమ్మ అంటే అంత నువ్వన్నా నాకు అమ్మ కాలేదు నా దగ్గర తొడపాశం పెడుతుందా నిన్న అడిగింది అనమాట ఈయన ఎవరు అంటే వాళ్ళ ఆవిడ అని చెప్పాను అది నాకు రివర్స్ ఇస్తుంది మంజు ఓకే విల్ డూ వన్ థింగ్ విల్ చేంజ్ అవర్ స్ట్రాటజీ ఓకే change your strategy right if you are comfortable discuss with them I'm my king okay I'm a king prime minister so how to close this one